Welcome everybody to our webinar today, HIPAA, the Road to Compliance. My name is Roger Schindel. I will be your presenter today. And again, welcome to you all. So thank you for joining us. Here's a little bit about our company. We've been in business over 7 years. I'm the founder and CEO. I'm certified in privacy and security through HIMA, American Health Information Management Association, and in IT audits through Information System Audit Control Association. All of our folks who are professionals in the organization are certified by one or more of the following organizations, the ones that we believe are the top in the industry, have been around the longest, and have and then finally, we're going to discuss how we might be able to help you. So a little bit more about who we are. Our current iteration started in 2012. We work with HIPAA compliance almost exclusively with small and mid-sized companies. Currently, we have 5 professionals and 4 support staff. Our corporate office is located in Crown Point, Indiana, with additional offices in Chicago, Augusta, Georgia, Iowa City, insurance agencies and companies, underwriters as our clients. We work with physicians, dentists, and chiropractors. We work in home health, hospice, and wound care practices. We also work with business associates, such as software firms, medical web portals, and the like, data storage and destruction firms. So a broad range of different kinds of clients that we work with on a daily basis. So why should compliance be on your radar? So obviously there are many reasons. The first one is identity theft. The second is medical identity theft. You have an obligation to your clients or patients to make sure that you're keeping their private information private, safe, and secure. So aside from your responsibilities to your patients, there are significant fines and penalties, both at the federal and state level, for violations of the regulations and inappropriate disclosure of both protected health information and protected personal information. Civil liabilities are now likely. There are a number of court cases out there in the civil courts regarding breaches of compliance, and the awards are many multiples of what you would see in the fines and penalties from the state and the local governments. Now HIPAA is being used in litigation as a standard of care. So if you're not complying with the HIPAA regulations, there are consequences in terms of lawsuits and your insurance policies. If you're not up to the standard of care, most policies have a clawback provision if you're not complying with standard of care. There are ethical and professional standards, and it's just good business. And we also need to be concerned with the new age of cybercrime that we have now entered. So let's visit some folks who didn't pay attention to the HIPAA requirements and see what the implications were for them. So the first one I want to talk about is Anchorage Community Health Services. The type of breach was an unauthorized disclosure. It resulted in a $550,000 fine. What happened was they failed to patch data systems that were running outdated software. And this is actually similar to, if you all remember, this past summer, the WannaCry ransomware attack. It only attacked and was successful with computer systems that were still running Windows XP. So one of the important things you want to do in your compliance program is make sure that you are patching all your software and operating systems. So OCR, Office of Civil Rights, when they conducted their investigation, determined that Anchorage community had failed to conduct a security risk assessment, failed to have appropriate policies and procedures to protect electronic protected health information, and failed to implement technical security safeguards and measures to reduce the risk to their protected health information. Second breach we want to look at is Aetna Health. Aetna Health actually had a breach of almost 350,000 records. What happened here was they had been leasing a photocopier, and you may or may not know that all photocopiers, printers, fax machines actually have hard drives in them. They take an image of whatever is being copied prior to making the copy. They store it on the hard drive. And in this case, the printer was returned to the vendor without the hard drive being wiped, having over almost 350,000 records on it. Ended up with a fine of a little over $1.2 million. Aetna Health, again, failed to do a security risk assessment that would have assessed and identified the potential security risks and vulnerabilities of information stored on the photocopier, and failed to implement adequate policies and procedures with regard to electronic medium. Next breach we want to look at is Parkview Health System. This is an interesting one. Parkview took control of between 5,000 and 8,000 patient records from a retiring physician while they were transferring or transitioning patients to new providers. Parkview employees actually went to the provider's home, left 71 cartons of boxes of medical records on the physician's driveway, resulted in an $800,000 fine. The corrective action plan from Office for Civil Rights included the requirement to develop, maintain, and revise written policies and procedures and provide adequate training. Office for Civil Rights almost always tags insufficient training as a reason for breaches that occur in their investigations. Also, it should note that in this case, and in many cases, when OCR finds a willful violation of the regulations, they actually have the ability to come in and monitor and oversee your privacy and security program for a period of years. In this case, they were looking over the shoulder of Parkview Health for a period of 3 years. Okay, here's another one, Hospice of Northern Idaho. This one was a small breach, 441 records. An unencrypted laptop computer was stolen. The fine was $50,000. Again, HHS, Human Health Services, or people that actually do the investigation, OCR, Office for Civil Rights, found that Hospice of Northern Idaho had not conducted a security risk assessment. This is something that you're going to hear about over and over again. The percentage of organizations that actually conduct an adequate risk assessment is very, very low, even in today's environment. Not having done the risk assessment, they also failed to put in place necessary safeguards to address the use of mobile devices. A laptop is considered to be a mobile device. And this was the first time that a small record breach was actually promulgated with a fine and penalty. And the idea was to send a message that irrespective of the size of the organization, your obligations under HIPAA are sacrosanct. Another one we looked at is North Memorial Medical. This actually was a business associate providing or working with protected health information from another company called Anchorage. What they found was that North Memorial, the business associate, had unencrypted password-protected laptops. Actually, Anchorage was a business associate, I apologize. Caused a breach of almost 10,000 records. North Memorial was fined over $1.5 million. Again, they had failed to perform the adequate or required security risk assessment. They also didn't have anybody in charge of the business associate relationships. So the point here is that you can actually be held liable for actions of your business associate, and they're causing a breach of your data, can end up causing you fines and penalties. This has been the case since 2013. Final omnibus rules passed and implemented, and now you need to be liable. You can be held liable for business associate breaches, which now puts an onus on you to evaluate your business associates for their compliance with the HIPAA regulations. Okay, another one. This was Lincare of Clearwater, Florida. So they lost 270 records, a small breach, but were fined $239, almost $240,000. What happened was an ex-employee of Lincare reported that his ex-wife had left PHI of patients in the car, under his bed, in kitchen drawers. He was not authorized to see the information. And at the time, employees were allowed to take PHI in record form or in paper form from the premises, and were, in fact, ordered to keep copies in their car in the event that something happened to a building. Not a very robust backup plan. The point of this breach actually is that it does not take a large number of records to get an enormous fine and penalty. OCR tends to levy fines and penalties based upon the level of compliance with the regulations as opposed to the number of records involved in the breach. Okay. Hollywood Presbyterian. This was unauthorized disclosure and access. This is an interesting one. It was one of the first times a hospital was hit by a ransomware attack. The ransomware was paid off with Bitcoin, but the hospital was offline for over a week. Some of you may have heard about the large EHR breach that occurred last week. They are now agreeing to the fact that a ransomware attack did cause the records to be compromised. For a number of years, both Homeland Security and OCR has been promulgating guidance that says that a ransomware attack is in fact a breach unless you can prove a low possibility or probability that records are actually accessed, which unless you have a good security plan in place becomes very difficult, and the number of records therefore breached can be very high. The other thing you should understand is the median time for a ransomware attack to occur and be successful to the time that it shows itself is 90 days, so that a lot of things can be going on your system as part of a ransomware attack that unless you have appropriate safeguards in place, you won't even recognize are occurring. So just an example of some other hospital ransomware attacks, and I just want to point out that these attacks aren't necessarily targeting large hospitals. Malware targets all providers indiscriminately. not based on size, because these are automated attacks by bots that are floating around on the internet. Once they discover an unprotected IP or internet protocol address with a system or a device attached to it, they will ping that device or system or port to see if the factory default settings have been changed to more appropriate settings. In 80% of the cases, factory default security settings are not changed, which gives the ransomware attacker easy access to your systems. Okay, so how do you protect yourself from these kind of breaches? And that's actually what HIPAA is all about, is keeping you protected and putting appropriate security and privacy protocols in place to keep the attacks from occurring and to address the attacks when they do occur. So here are the components at a high level of what constitutes a HIPAA compliance program. First thing is you want to conduct your risk assessment, which virtually everybody in the preceding set of breaches had not done. That risk assessment then needs to create a remediation plan. So the risk assessment percolates up areas of high-risk vulnerabilities. The remediation plan is your roadmap to, as it says, remediate those vulnerabilities. It's time sensitive, so you can demonstrate reasonable, meaningful progress through your remediation if and when you need to show that to the regulatory agencies. Once you have the remediation plan and the times laid out, you're then going to go correct all your deficiencies. And then finally, once you've corrected the deficiencies, you need to be auditing and managing on an ongoing basis to make sure that your implementation is being adhered to. And then, of course, throughout the process, you want to do as much training as you possibly can. As I said, the regulatory agencies tend to take the position that virtually every breach can be traced back to inadequate training. And so they put a high score on the amount of training that you do, trying to get you to build what they want to call a culture of compliance. So the risk assessment, let's talk about that for a moment. So basically, did it follow NIST 800-30? NIST is the National Institute of Standards and Technology. 800-30 is the white paper or the paper that they developed to talk about how to do risk assessments. Essentially, it's a probability-based assessment. It's not a checkbox, but for every vulnerability that is identified in the regulations, there are 88 on the security side and 44 on the privacy side. You need to assign a probability that that vulnerability will come to pass, and also the level of impact that if that vulnerability comes to pass will have on both you as the practice and your patients or clients who have had their information inappropriately disclosed. So the takeaway from the risk assessment is it's a multivariable probability-based algorithm to come up and create a risk score. That risk score then is plugged into a remediation plan so that you can remediate your high-risk items first, then your medium-risk items, then your low-risk items. And then, of course, your security risk assessment and remediation plans need to be updated on a regular basis, which means typically annually, whenever you have a change in the way you operate, and whenever you have a security incident, you want to update the relevant portions to try and understand why the security incident occurred in the face of your safeguards and policies and procedures. So this is an example from our software, proprietary software called HIPAA Suite. It's a sample of the kind of things you look at a risk assessment. We give you all the information on the right-hand side of the screen. About the vulnerability in the regulation. We don't then ask you a question, and while this looks like a yes or no question, what's built behind this is the probability-based algorithm, and we spend a lot of time figuring out what those probabilities will be and what the impact is. That's something that changes over time. So we put that behind the scenes for you so you don't need to be worried about it. And then we ask multiple questions around the same vulnerability to build up a robust score so that we can get a good risk score profile for each of the vulnerabilities. This is a graphical depiction of what's going on behind the scenes. So for every threat, which are the vulnerabilities that are outlined in the regulations, we associate a likelihood or probability of that threat occurring, and then what the impact will be. And then based upon those items, we roll up a risk score for the remediation plan. This is a sample of a remediation plan. As I said, it has the risk score associated with it. It has the threat or the vulnerability in the regulation. It has an action plan. It has someone assigned to be responsible for making sure the safeguard is implemented. We have the approver who's going to do final approval of the safeguard, in fact, was implemented. And then, of course, we have the target date so that we can demonstrate meaningful progress through our remediation when a regulatory agency comes asking for it. Okay, so have you corrected your deficiencies? So this is an archetypical policy. We're actually going to send this to you when we send you your training certificate to give you credit for training on this policy and procedure. They all start with a purpose. They have who's responsible for implementation, the scope. It may be for one department, it may be for one location, it may be company-wide. Then we have the actual policy of what we're going to accomplish. And then we have the specific procedure, which are the steps to implement the safeguard and what that amounts to. We then have the applicable regulation and standards. It's important to have these associated with everything you do around HIPAA, because when the regulatory agencies come to do an investigation, they're not going to say, show me all your policies. They're going to say, I want to see your policies, related to some topic, and they'll reference the regulation number. So what we do is we index everything by regulation number so you can achieve the required document request submission that you'll get as the first step in the investigation within the 20-day period that the regulatory agencies give you to comply with the document request. 20 days may seem like a lot of time until you're actually trying to pull multiple years of information together from disparate sources and trying to figure out which ones are applicable to the request from the regulatory agency. The other thing you want to do is, again, you have distribution, and you want to keep a version history. The regulatory agencies have the ability to ask you for 6 years worth of information on everything around HIPAA, and they have the ability to ask for all modifications. So it's important when you're doing your safeguards in your policies and procedures that you have version control, that you can demonstrate and document multiple versions of the same policies because you may be asked for it. Okay? So once you've put the policies and procedures in place, then you're required to have an ongoing auditing and monitoring program around your privacy and security. So this is the model that we use. Basically, we go through and we look at what was being monitored, how were we doing the monitoring, and when did we do the monitoring. So what are the goals and targets, what are the metrics and methods, and what is the frequency. So as an example, if we're looking to monitor policies, we're going to look at what are we monitoring, what are we auditing. It's going to be compliance with the policies and procedures. How are we going to do that? We do that with chart audits, observations, and surveys. And when are we going to do that? We're going to do that on a variable basis. So we may put the policies on different cycles to monitor once a year. Some we can monitor every other year, and some even every 3 years. Another example is training. And we're going to look at what are we going to look at. We're going to look at whether all workforce members have been trained. How are we going to do that? We're going to reconcile training reports against the list of workforce members. And we're going to do that on a variable basis. And then the last one is safeguards. So what are we going to look at? We're going to look to make sure all of our safeguards have been implemented the way we say they're going to be implemented inside the policies and procedures. How are we going to do that? Actually, we're going to do a walkthrough so we can validate that the safeguards are being implemented as described. And again, that's going to be on a variable basis. Okay. One of the areas, as we pointed out, the breach where a covered entity was fined for an issue from a business associate. You're now going to, since 2013, you're required to do due diligence on your business associates. The reason for that is you are required by regulation, and I put it up here, reasonably anticipate, identify, and protect against threats to your security or integrity of your information. And you need to protect against those both for security and privacy purposes. And one of the issues people don't understand is that if you uncover a pattern of noncompliance with the HIPAA regulations by one of your business associates, you're actually required to terminate your contract with them if feasible. So there is a caveat. If someone is a sole provider of a service to you that you can't get anywhere else, then you can make a strong defense justification as to why you're going to continue to work with a non-compliant business associate. But that should be, rarely are you going to be able to make that kind of argument. It's better to make sure your business associates are compliant with the regulations to make sure that you are safe and secure with the information you're providing to them. Okay. So training requirements. This is an area where people, again, misunderstand what they need to do about training. So all workforce members must be trained on the policies and procedures relevant to their position, to their job. I know many organizations will do an in-service or once a year buy some training and go out and train their employees on the generalities of HIPAA. And that's great background information to have, but it does not comply with, nor will you pass regulatory scrutiny by the regulatory agencies, because they expect that you're training on your own policies and procedures. This is the reason why Office for Civil Rights attributes inadequate training to virtually every breach that they investigate. New workforce members need to be trained within a reasonable period of time after they've joined the workforce. Workforce member is anybody in your organization who is either working with, may potentially see protected health information. So that includes volunteers, interns, boards of directors, along with your line staff. So training must be documented. You need to document who was trained, when they were trained, what they were trained on, who did the training, and you need to have a copy of the training available. And the training, like most everything around HIPAA, needs to be retained for 6 years. The regulatory agencies have the ability to ask for 6 years worth of history on everything you're doing in training or everything you're doing around HIPAA. And again, just to focus the point again, your training must occur on your own policies and procedures. So the summary of the requirements to be compliant with the HIPAA regulations are to complete your security risk assessment, and we recommend you do the same kind of protocol for your privacy, so privacy risk assessment. While the regulations don't specifically say do a privacy risk assessment like it does on the security side, you still have an obligation to identify the vulnerabilities, the level of risk, and to remediate those items that have high risk and even medium and low risk. So once you have the protocol figured out for the security side, we recommend you do the same thing on the privacy side. That's actually what we do with our clients. And it's part of what's built into our software, as I said, called HIPAA Suite. You then need to produce your remediation plan to correct the deficiencies on the security and privacy side. Again, it's a time-sensitive plan. You need to provide workforce training on your specific policies and procedures. You need to audit and manage your HIPAA compliance. To make sure you're doing what you said you were going to do, and you need to complete due diligence on your business associates. So how do you get there? So you have some compliance choices. The first one is to hire a full-time privacy and cybersecurity expert, or train one of your employees up to have sufficient knowledge. But then the average salary for that expert is somewhere between $100,000 and $180,000 to start. Virtually anybody I know who is well trained around HIPAA can walk into any hospital in the country and start at between $100,000 and $180,000. So it becomes difficult to keep individuals who are well versed in HIPAA in your practice. And additionally, you're only going to use them about 10 to 20% of their time. So you're hiring someone at an enormous salary to get value out of the 10 to 20% of their work hours. So that's typically not a satisfactory solution. You can try to maneuver through HIPAA's privacy and security on your own and risk everything. And everything means be subject to enormous fines and penalties. Anymore, they're going to start at $50,000, go up to $1.5 million per same violation per year, along with civil suits. The average civil suit pegs the settlement at about $3,000 per record. The median size breach is 3,500 records, so that can be enormously expensive. Or you can look to someone like us. We have two different products that we work with our clients with. We have one called HIPAA Express, where we do security and privacy assessments, develop remediation plans, have ongoing weekly webinars to customize those policies and procedures, and we do the business associate management for you. Everything's done as a group, so it's a relatively cost-effective solution, $2,500 plus a little bit more if you have multiple people attending the Express. We do them in person, and we do them online. And then we have something called HIPAA Select, which is a custom program which would be unique to any organization, which includes everything in the Express, although we do it personally as opposed to as a group. We do the ongoing security and privacy audit program. We do all the staff training, and we do actually, as part of our support, we evaluate all your security incidents, and if they're reportable breaches, help you through the process of reporting the breaches, and we'll actually help defend you when those breaches occur. So when you're putting your documentation together, we're there to help you work through that. So at a higher level, this is what we're offering: the ability to help you complete the risk assessment, help you create the remediation plan, customize your policy, procedures, and safeguards, assist in evaluating security breaches and incidents, and vet your business associates, and additionally train your workforce. So the first step to getting to that program is another service we have. It's important to know where you are in your privacy and security program. So we've created something called HIPAA Diagnostic. And the HIPAA Diagnostic allows us to go through. It takes 20 minutes. It's free, no obligation. It's a high-level assessment of your security and privacy program based upon areas where Office for Civil Rights has identified the most common areas where people are not complying, things like doing a security risk assessment. We then provide a report to you so you can review it, take that to management, have a conversation about how well you're in compliance, what areas you need to beef up in your compliance program. And we will consult with you, one of our privacy and security experts, to walk through where you are in your program and what you need to do as a next step. You can register for the HIPAA Diagnostic by going to HIPAAdiagnostic.com. I believe we're going to put that in the chat box so you have a live link. Or you can call us at 888-534-0901 to go ahead and set up a diagnostic. Again, it's complimentary, no obligation. Takes about 20 minutes to go through. Okay, so any questions? While we're waiting on questions, there's a link here called HIPAA Compliance, USA.net webinar questionnaire. It'll actually pop up when you close your browser and leave the meeting. But while we're talking about questions or waiting for questions, feel free to go out and fill out the survey. It's required to get your training certificate and get the policy and procedure that we're giving away. Here's a question. So what exactly is a business associate? It's actually a good question. There's a lot of misunderstanding around that. So a business associate is someone that you have retained to do a job for you that requires the use of your protected health information. So typical business associates would be, if you're using an electronic health record system, an EHR, the vendor will be a business associate because they're typically storing information off-site, or they have access to the software to bug technical issues, or they'll log in to help on a training issue. Most people say, well, we're not going to look at live data, we'll use dummy data. But having been in that industry for over 30 years, I know that typically you end up looking at client or patient data, so they're going to end up being a business associate. So your EHR vendor is a business associate. If you have someone who is doing billing for you or revenue cycle management, they're going to be a business associate because they're going to need to see protected health information to do the billing. Your ISP is explicitly defined as a business associate in the regulations. Any cloud service providers you use for storage will be business associates. In some cases, your accountant and your attorney will turn out to be a business associate. So any of those folks will work with protect the health information that you have created to do a task for you. That's the definition of a business associate. Someone who comes in and washes your windows, cleans your offices, they're not going to be a business associate, so you don't need to have a business associate agreement with them. In fact, it'll get very onerous if you end up asking them for a business associate agreement. You'd be asking them to do a lot of things that they typically aren't going to do. Okay, any other questions? So here's one. What is the chance that I will end up being audited? That's another good question. We hear quite a bit about the audit program that OCR, Office for Civil Rights, runs. The number of people they currently audit means that your likelihood of being caught up in the audit program is very, very low. That's not what you should be concerned about. The most likely way that you're going to interact with a regulatory agency is either that you have a breach that you need to self-report, and if you don't report it and you get caught, the fines are enormous, or someone's going to file a complaint about you or your practice. They have the right to do so. They can actually file anonymous complaints. It's all done online, and you would end up at that point potentially being investigated by Office for Civil Rights. So at this point in time, don't focus so much on the fact the audit program is out there, but rather that you're most likely to have to self-report or someone will file a complaint. Patients are getting very savvy and concerned about how well their privacy is being protected by their providers. And in fact, one recent study said that over 50% of patients would switch providers if they thought that they were going to have more safe and secure protocols around their protected health information. Okay, one last question. My association provides HIPAA training. Is that not sufficient? Again, the challenge is that getting the training that the association does is typically a very good background that has enormous value for your practice, but it will not satisfy the requirements of the regulations unless the training is on your own policies and procedures. So we don't ever dissuade people from doing that generalized training. We, in fact, do it for our clients also, but we need to take the next step, which is train on the specific policies and procedures that you've implemented for your practice. Okay, any other questions? Okay, well, I see that our time is almost up. I want to thank everybody for attending. Please fill out the webinar questionnaire so we can send you your certificate of completion and the policy that you're going to get from attending the webinar. We hold webinars twice a month. The webinars on the second, on the last Wednesday of the month are always on different topics. So we hope to see you at another webinar soon. Thank you.